Senator Ayotte.
I want to thank the chairman and ranking member and all of you. Appreciate, obviously, why we need this. We've all had incidences in our state. A number of years ago, we had an incident in New Hampshire that prompted an early discussion in our state about this, where we had a horrible, horrible madman who basically murdered a judge, murdered troopers that were trying to subdue him, murdered a local newspaper person, and the radios didn't talk to each other. And that was to the advantage of the perpetrator and allowing to use that situation to cause more deaths. Right. So this is a real issue. And as I think about our state, I know that the consultation in New Hampshire, I guess, is going to be June 9th, I've been told. Right. And you have said, Ms. Swenson, that you're going to get the feedback from the states, and particularly as I think about Chairman Thune's question, 2/3 of my state would technically be really rural areas where we have challenges on how do we build the network that people can talk to each other. And in that process, where you take New Hampshire's feedback and every other state's feedback, and then you put together the RFP for the end of the year, will the states have a feedback loop? In other words, you sit down with them on June 9th, they tell you what they think, and then you're putting together an RFP. Is there another opportunity for them to see the RFP or to see what you're working on to make sure that their views are reflected on it?
Well, thank you for the question, because I really want to emphasize that consultation is a broad and ongoing process. It's not a one-time event. We talk a lot about the state consultations, and I think it's really important that people understand what we're trying to accomplish there. But our relationship with the states is ongoing. As I indicated, we have conference calls. We are available by staff. We have emails. We have face-to-face meetings. Also, I would tell you that as we go through the process of consultation and the RFP, and then we actually deliver a plan to each governor for the plan for their state, that will not be a surprise. We want this to be a very iterative, very collaborative process, so that when you get that plan on that day, you've been so involved in it, there should be no surprises. I mean, that's really the mindset that we have around the process. I mean, this is it's very important that we all work together. And we, as you know, we've been somewhat limited on staff, but we're adding people to make sure that we have the right number of people to be available to you and your team so that we can be effective in the information that we're providing you.
Good. And one of the things we're hearing from feedback from people on the ground in New Hampshire is they're saying, what's the benefit of FirstNet? In other words, the local agencies that have frankly been working on this issue for years, so this is a new issue for law enforcement and for first responders like the chief here, and they're saying, why should we opt into FirstNet versus perhaps using a private distributor? And, you know, and part of this plan, I assume, is how do we maximize commercial opportunities given the resources we have. So what would you say to that issue? And perhaps because you're so new, that this worry that we don't know what to expect from the first responder community, you can understand why that would be, you know, a pretty real one.
Sure. Would you like me to answer?
Yes, I'm curious what you would say to that, because I mean, I just tried to get some local feedback here. What do you think about this? What are you hearing? What's your initial impression?
Well, I don't think your feedback is different than what we hear, which is why we're trying to be out, as Chief Bryan said, with as many of the constituency as we possibly can. It is not uncommon. I go to my local grocery store and talk to firefighters and law enforcement, and I ask them if they know about FirstNet. It's a lot of people out there. I mean, there's hundreds of thousands of people that we need to get that message out to. So I'm not surprised at what you're hearing, but we're working very hard to get the information out. I would tell you from a benefit standpoint, you know, what we try to communicate, because it's not unusual that people don't understand why should we do this versus that. One of the things is the rural coverage. I think the rural coverage is really a critical differentiator. This is a dedicated network. This is not a network that is used by all of us. What happens when you have an incident? What is the first thing all of you do? You get on your cell phone.
I would argue without rural coverage, you probably could do this quite easily commercially.
Well,
It's
and-
the rural areas that really we need the help the most.
But I think it's more than that, because commercial is basically focused on commercial. I mean, that is their focus, and they have shareholders and earnings releases and things that they have to worry about. We don't. The money that we get from this, we're going to reinvest in the network. So it's dedicated. It also has priority and preemption. So the funding that we're going to get from this, as we said, we have $7 billion from the last auction. We have spectrum that is very valuable. It is beachfront property. I mean, it is really, really good spectrum. And so getting the revenue from that will enable us to, along with user fees, to be able to operate this network. And I think what's really important for, I think, first responders and for anybody interested in this is that we're talking about a recapitalized business model. If you look at the systems, if you look at the systems today, the LMR systems, land mobile radio systems that are in existence today are old. They're 10, 15 years old. It's very difficult for agencies to get the funding to upgrade that. The model that we have is talking about upgrading that as technology presents itself. For example, if we start to deploy this network and we move from 4G to 5G, then we will be deploying 5G. So we're going to give first responders the technology that we enjoy as consumers today as that technology evolves. We also are going to be working we're still working on the standards around this, but ruggedizing the network for particular circumstances in your state, in all the member states. We want to understand what those circumstances are, and we're working to define hardening standards so that we can try to harden the network to withstand those incidents that, from a weather perspective, that would affect the network. So we also are going to have applications. I think the development community is going to get very excited about the applications that can be made for public safety. This is an organization dedicated to public safety. It's not secondary, it's primary. And commercial networks, I was one, I know where the priority is. It's about, finding customers, getting revenue, responding to shareholders every quarter. FirstNet is very different. This is and I think it's really important for people to know, even if you decide to let us deploy your network in your state instead of building your own radio access network, the public safety agencies are not obligated to sign up. There's not a mandate that they have to. So think of what that says to us in terms of developing this network. We have to create a compelling value proposition that gives them more value than they have today. And so that's why we're spending so much time with public safety, is to understand their needs so that what we deliver to public safety is what they're going to want to use. So we're very conscious of that issue, and we're working very hard to get information out. We're working actually with the associations to try to get more information out to the people who are on the street, because it's very, very difficult. In fact, we were at the FOP meeting in San Diego last Saturday, and law enforcement in San Diego was not that familiar with FirstNet. But our staff and I presented at the FOP meeting to educate, 150 people at that session. So we're working very hard to get the message out. If there's more we can do, we're open to suggestions.
Absolutely, thank you.
you.
We'll certainly want to make sure all of our first responders are informed.
Right.
Appreciate it. Thank you.
you.